Hi everyone, it's Dr. Sinta, and Saki is making an appearance. And I'm here today to talk to you about just certain things we're seeing in our clinic and questions that I've had online as well. And hopefully at our Ask Me Anything, you can get your questions answered and maybe even learn some things you didn't know. So let's start with question 1. Are you good? Is it time? Let's go. All right. Question number 1 is, what are some upcoming medications in medical weight loss? What's new on the market and expected to come out soon? So what we're going to start to see is more oral medications come out that are like GLP-1s, but they're oral, or they're GLP-1s that are oral. And we're also going to see some injectables come out that are actually much stronger and hit different receptors. So, for example, Eli Lilly's coming out with, I'm sorry if I butcher this, orforglipron, and it is a GLP-1 agonist that is an oral pill that you can take. Now, the thing that you have to keep in mind is these meds do work very well. You got 10 to 15% weight loss, but they do have a lot more side effects because now they're going through the GI tract. So that has been some of the things that they're seeing in the studies, and we're hoping that the side effects will be a little bit better so they can be better tolerated. There's another oral Wegovy. Now there's already oral Wegovy out. It's called Rybelsus. And now what they're going to do is get Rybelsus approved for weight loss, and then that will be out too. The weight loss is okay. They're declaring that in their studies they're getting 10 to 15%, but I don't really see that with my patients that are on it. So that's what I can tell you about that one. And then another one that's out is peptide right now, but they're going to have do some studies to get it approved, and that is Retiratide, and this is by Eli Lilly. It's a triple agonist, so it targets GLP-1s, GIP, and then glucagon receptors. And this is insane, the weight loss they're getting on this. Phase 2 trials show 24% weight loss over 48 weeks. So that is the best that we've ever seen. It's an injectable, so it has less side effects, believe it or not. And it works, it looks like it's gonna work well. So when we can expect these, the Eli Lilly drug or Orforglipron is supposed to come out early at the end of this year or early next year. The oral Wegovy, they're looking at Q4 in 2025, so that's exciting. And then Retiratide looks like it's going to be early 2026. So hopefully that answers that question for everybody. All right. So question number 2 is, I heard that if you stop a GLP-1, you gain all your weight back. Is that true? So I get this all the time from people, and what I can say is this. You start out with a set point weight, and then you lose weight, and you have a whole new set of circumstances your body's dealing with. You're hungrier, your hormones that fight satiety don't work as well, and your metabolism is lower. So now, if you were to just stop everything, you're going to go flying right back to your old set point. What our goal is to set up a new set point for you, and the way that you do that is you keep a med on, and you can microdose it. This is what we're doing with GLP-1s, trying to get the lowest dose possible, but you still stay on it so that you can have the set point be lower and that you have better weight loss overall. These drugs have been proven long-term, and they've been around, as I've mentioned before, since as long as 2005. So I think we've got some good test of time data on how safe they are long-term. Okay, so question number 3 is, all I hear about are GLP-1s, is that all that's out there? And the answer to that is definitely not. There are other medications out there. They are getting all the hype right now. But there's oldies but goodies that we use a lot of at our practice. One is phentermine, and phentermine is a medication that increases metabolism and decreases hunger. It's a great drug for people who have a lower metabolism and and have hunger at the same time, which is just about everybody. Been around since the 1950s, tried and true. Long-term data looks great on it in terms of safety and efficacy. We have medication Contrave, which is Wellbutrin and naltrexone together. It's good if you've got someone who's got some depression and you want to help them with the weight loss as well. It's, I think it costs about $99 now with the coupons, so it's at least a little bit more affordable than it used to be. But it's just one that we use sometimes and add on to the meds that are already out there. There are two meds that we use a lot of in our practice that are called, well, the names are Topamax, topiramate, and Vyvanse. And those two drugs are used to help with the hedonic hunger. So that's the hunger that is caused by, just wanting something or craving something, getting into something and you can't stop. That's what those particular meds work for. You might have heard of it for attention deficit disorder, but it actually works very, very well for binge eating and carb cravings and that kind of thing. Just to kind of summarize, GLP-1s are medications that have been around for diabetes since 2005. They've become very popular in the last 5 to 7 years because they've gotten approved now for weight loss. And they are, instead of once daily injectable, which used to be around, we now have once weekly injectables. So you don't have to think about them as much in taking them, but they're not for everybody. And there's other things out there as well. And the doctors that do what I do, obesity medicine, and where we've really been working with these things for a while, know which drugs to put on at which times. So that's important to understand. This is a good one. So we hear that there's massive muscle loss with GLP-1s. Is that true? As far as the muscle loss goes, what we have to do is make sure that people stay on a diet, that they're eating, that you have them on the right dose to trigger their hunger when they need to eat, but are full enough so that they don't eat too much. So there are nuances to that, and having done this for so long, you kind of get a sense of who needs that. But what's happening out there is there's a lot of people who are getting these drugs prescribed by doctors that have not used them before and so don't know the nuances. So it's very easy to just stop eating on them, and I think we're seeing a lot of that, and you have to be careful. I have been on a GLP-1 and my weight loss has plateaued. What do I do? Okay, so you can get a weight loss plateau because your body's gotten used to that dose of the drug. You can get a weight loss plateau because you're under eating. You can get a weight loss plateau because you're just not eating the right things. So when we see a weight loss plateau, we always want to figure out where we are with the drug, especially GLP-1s, because you may need to go up or down on them to get the person to lose better. I heard you mention phentermine a lot. Why do you like that drug so much? So phentermine's been around since the 1950s, and it's really been tried and true and well tested and works great. I love it because it's the only one that actually increases metabolism, and that always makes the weight loss go a little faster. It's a pill, it's well tolerated, and people tend to do very well on it. And it doesn't matter the age group, men, women, young adults, or even teenagers can use it. And it can go very well with the GLP-1s. You can just attach it onto the GLP-1s, and you start with phentermine, add a GLP-1, or the opposite if the person's getting stuck, as we just talked about. What is the best diet out there? I hear this all the time. What's the best one? Is it keto? Is it intermittent fasting? What is it? And to tell you the truth, this is going to be kind of a simple answer. The best diet out there is the best one that you can stick to in your life at this time. So if you can follow a keto, then that's a great diet to be on. If you can follow meal replacements, that's a good one to be on, so calorie restriction. We see a lot of intermittent fasting, which works very well too, but you have to be able to fit it into your lifestyle. So studies have shown the best diet truly is a diet that you can stick to. Next question. I've been exercising like crazy and can't seem to lose weight. What am I doing wrong? Well, exercise is just a piece of the puzzle, and to be honest with you, it becomes much more important in maintenance than it does in the weight loss phase. Sometimes you can exercise so much that you make yourself more hungry, and then you don't stick to the diet plan. So the true weight loss comes from the food, it comes from your kitchen, not from the gym. My husband and I started a weight loss plan at the same time. He's losing way faster than I am, and it's making me mad. What do we do? Well, this is just something that you have to understand, that metabolism is driven by muscle, and men have more muscle than women. So if you're going to do a weight loss plan with your partner, and you're both, one is a man and one is a woman, the muscle mass in the men's going to make their metabolism go faster, so they're going to lose a lot quicker. And it doesn't mean that you're doing anything wrong, it's just the way we're built. Can you tell me how sleep affects weight loss? So sleep is so important, and we ask everybody who comes into our office how much they're sleeping, because it does a couple things if you're not sleeping. Number one, your ghrelin, which is a hunger hormone from your stomach, it kicks up and it makes you want to eat more the whole next day. So that's something that we see. Sometimes people get up and actually eat to fall back asleep, so that can be a problem. And then the things that you crave the next day when you haven't slept are carbs and sugar and things like that to keep you awake the next day. So it's sort of like a triple whammy there. So sleep is everything. We really need to be sleeping well in order to lose weight well. And there's lots of tricks you can use. I'm a big fan of magnesium glycinate, 100 milligrams, 1 to 2 before bed, works great. Melatonin, there's nothing wrong with melatonin, just don't go too high on it. 5 milligrams, usually you can combine that with the magnesium too to help you get to sleep. So thank you very much for those of you who submitted questions, and hopefully you guys learned a little something here. But always happy to answer any questions that you might have. Hope you have a great day. Oh, and don't forget to check us out on Facebook at Medical Weight Loss of New York, on Instagram, Dr. Wendy Cinta, and what am I forgetting? YouTube as well, under Dr. Wendy Cinta. Okay, have a great day. Bye.